renal cell carcinoma. So here we're going to look at the renal cell carcinoma and also the histological subtypes. So histological subtypes. So here to begin with some questions. The first question is, what is the papillary type? Name some important findings in the papillary type. Second question will be the medullary type. What do you understand by the medullary type? Name some significant findings in the medullary type. So here we are going to find out the answers to these questions and learn in detail. First we are going to look at the clear cell type. So under the clear cell type, we need to know that it is the most common type and it originates from the PCT, proximal convoluted tubule, and it is caused by the deletion. So the deletion, it is caused by the deletion of the chromosome, that is the 3p and the 6p. It is associated with the von Hippel-Lindau's disease. It is associated with the von Hippel-Lindau's disease, that is a VHL disease, as well as the tuberous sclerosis. Tuberous sclerosis. Then we are looking at the papillary type. So under papillary type, we need to know it originates from the PCT as well as the DCT. And what is the cause? It is caused by the c-Met. It is caused by the c-Met mutation. And the histopathology, if you see, it is nothing but Samoma bodies. It is nothing but the Samoma bodies. Now we are looking at the associated. What is it associated with? They are associated with the hereditary. It is associated with the hereditary papillary renal cell carcinoma. And another point to note is that there is the micropapillary variant. There is a micropapillary variant. So this micropapillary variant is associated with the long-term dialysis. Next we move on to the chromophobe type. So what happens in the chromophobe type? The chromophobe type is nothing but it has the best prognosis. There is a best prognosis in terms of the chromophobe, and it originates from the from the intercalated cells of collecting ducts. The intercalated cells of the collecting duct. And later we look at what is it caused by. So the cause is by the loss of multiple chromosomes. So loss of the multiple chromosome. So what does it mean? Chromosome 1, 2, 6, 10 and 13. Also at the extreme, hypodiploidy. Then we need to know what is it associated with. It is associated with the BHD syndrome. What does it stand for? The Birt-Hogg-Dubé syndrome. Then next we look at the histopath. So what is a histopath? The histopath, it shows plant-like cells. It shows a plant-like cells. Also the resin-like nucleus. And the cytokeratin, it is the cytokeratin positive, the cytokeratin positive on the IHC. So the plant-like cells and the resins in the nucleus and cytokeratin positive on the IHC. Later we move on to the collecting. The collecting, or it is known as the Bellini, collecting of the Bellini duct. So what is this collecting of the Bellini duct? So we need to know this has the worst prognosis. So the worst prognosis is with the collecting duct or the Bellini duct. And as the name suggests, it originates from the collecting tubules. Now to move ahead, what is it caused by? The collecting duct is caused by the deletion. So there is the deletion. A deletion of what? There is a deletion of the 1q. Also the monosomy. There is a monosomy of the multiple chromosome. Next we move on to the medullary type. So what is special about the medullary type? The medullary type, it has a poor prognosis, and it originates from the distal nephron. It originates from the distal nephron. So what is this associated with? The medullary type is associated with this is important, sickle cell anemia. Now we'll be looking at answering our questions. So the very first question we asked was, talk about the papillary type. So under papillary, we need to know it originates from the PCT or the DCT, and it is caused by the c-MET mutation. And they have a very characteristic significant. There is a histopath. It shows the presence of the psammoma, bodies. And other thing to note is that it is associated with the hereditary papillary renal cell carcinoma, and there is also the micropapillary variant. There is a micropapillary variant, and this micropapillary variant is associated with the long-term dialysis.